As the founder of Indo-US Organization for Rare Diseases, our organization plays a very critical role in this ecosystem in bridging two great nations, United States and India, and other countries wherever Indian diaspora exists, to bring complementary resources in bridging massive inequities that exist in rare disease and orphan drug development. There is only 5% of rare diseases that have an approved treatment. 95% of rare diseases don't have any approved treatment. That's the gap that we are looking to fill. And we believe the secret lies in bridging the entrepreneurial innovation in the United States with the chemistry prowess of India in manufacturing and controls. And that's our focus is being patient-centric. How can we bring various stakeholders to take advantage of the great strengths that United States and India bring together for the greater good of mankind? To me, rare diseases is personal just because as I was completing my postdoctoral training at the National Institutes of Health, I became a parent of a child with rare congenital disorder called Edward syndrome. That's what gave me the why of what I was doing. And I was already involved as a data scientist in terms of rare disease research and clinical genomics. But when you have a loved one affected and even pass away because of a rare disease, it gives you a whole new meaning and purpose and mission. And since then, I took it as a calling, and that's been my why for last 12 years. I don't feel like I have a job. I love what I'm doing, and I can see the impact that it can have, not on one patient at a time alone, but also on a much bigger scale, to impact all patients affected by one or more rare diseases, and there are 11,000 of them. On the one hand, in the United States, we have the Biosecure Act, which is requiring the US-based biopharmaceutical manufacturers to bring manufacturing out of adversary countries such as China to more friendly countries such as India, or even back to US. So that's there is a time frame that the government has provided up to 2032. So there is still a few years left, but the planning of retracting that manufacturing out of China and other adversary countries is already started. And hence that offers a unique challenge to US-based companies, but an unique opportunity to India-based high-quality compliant manufacturers to benefit from this and play a role. On the other hand, the Inflation Reduction Act in the US has a lot of the pricing control that's imposed, and also taking away the incentives on drug repurposing. That also impacts the ability for rare disease research and development to tap into drug repurposing opportunities. On the other hand, in India, we have the National Policy for Rare Disease that's created a huge window of opportunity and hope for patients, millions of patients in India that have been waiting for therapies, both approved therapies that are unaffordable, but also therapies that are still under development and will be developed in the future. And that offers a great opportunity to capitalize on the opportunity created from the US policy changes and the Indian policy, new national policy. And that's where I think I see that more exciting and not concerning, luckily, right now. This summit, I have been a social entrepreneur and been part of co-founding several non-profit organizations to make an impact for rare diseases on national and international scale. But what I and our board members realized is unless we have an in-person event like this at least once a year, where everybody comes together, meets face-to-face, interact, and have that physical touch and feel, it's not going to have a big impact. And we could see that here this year at this summit, Indo-US Bridging Rare Summit 2024, we had the Honorable Minister of State for Rural Development and Communications, Dr. Chandrasekhar Pemasani. We were so honored to have him, and his presence made such a huge difference. And he took the time to listen to us, listen to the patients, and hear our pains and what solutions could exist. And he has offered to have listening ears and have some action plan. So he has requested us to put a very concrete proposal out to the minister. And so we are very excited that happened, as well as the other brilliant keynote speakers and chief guests like Dave Pierce from the International Rare Diseases Research Consortium. He is the chair of that consortium, and it's a global coalition of various countries coming together to tackle rare diseases as a global public health challenge. And India has a seat at this table, and that's exciting. And it's a testament that the chair of URDERC made the trip from United States to India and be here with us all 3 days and participate so actively, both at the gala celebration where we honored the first ever indigenously developed CAR T cell gene therapy for leukemia and B-cell lymphoma that came out of India at 10% of the cost of current incumbent products that are out there, which was very unaffordable. I think India has proven that we have the ability, if we apply ourselves in the right way, to produce advanced therapies at an affordable price. And that's offering hope not just to patients here in India, but globally, including in US, where these gene therapies are unaffordable at $2-3 million. And that's just not sustainable for rare disease community. So I think these 3 days have culminated in a very concrete vision that was crafted by our third keynote speaker, Dr. Amrut Ray, who gave a very great overview and 4 goals for us to consider as we try to make an impact between US and India, as well as Dr. Peter Marks from the US FDA, who gave a regulatory keynote this morning, talking about their effort to make US FDA have a global impact, particularly in cell and gene therapies, where there's close to about 20 gene therapies and over 40 cell gene therapies that have been approved by the US FDA. They have realized it can't be a national focus anymore, and they have programs like Cogent and others, where at the START program and several new initiatives of the US FDA with a particular focus on making it global. And that's the most exciting things that have happened in the last 3 days, in addition to many other activities like the Pitch for Rare and the hackathon. Those were very unique and innovative things that we tried for the very first time at this summit. I think IndoUSrare has arrived. The Indo-US Organization for Rare Diseases has done a phenomenal job of attracting the support from all the right quarters, where be it government on the United States front or Indian side, be it patient advocacy groups through the Patient Alliance Program, the Corporate Alliance Program, and the Patient Concierge Service. We have earned the trust of all stakeholders on both sides, and that's telling at this summit. As you could see, the kind of speakers and the interactions and the passion and the intent was very clear. Everybody is here because they care, and that's what makes this IndoUSrare very apt organization to take the rare disease community to that next level and really act with a sense of urgency. So I think IndoUSrare is extremely well positioned to make a significant difference to the lives of patients with rare disease.